Once again, our Astria Health House Call segment. We've come to really enjoy these, and it's a little wonder why. It's good to learn new things, and it's good to learn what services are available for us in our valley.
Indeed, it's just a little awkward doing the interview in one of those gowns. You know, the back keeps flapping open. But,
I know.
It's one of those things. Kidding, joking aside, Joseph Penaflor joins us this morning. Joseph is a board-certified psychiatric mental health nurse practitioner. It seems like maybe just within the last week or two, we have also talked with folks who have a mental health expertise. And so, Joseph, welcome. First of all, good to have you here.
Thank you for having me.
Oh, you bet. I guess I would start with saying just it's not a coincidence that Astria has a number of folks with mental health backgrounds coming in for these house calls. That's a focus for you folks, isn't it?
Yes, it is. Astria, here at Astria, we recognize that mental health is very important, just as so is general health. We have the goal to expand mental health to people closer to home, so we pride ourselves in that goal.
You know, we hear oftentimes politically, and it's always associated with crime and cleaning up the aftermath of crime, that the state needs more mental health. We've got to provide more facilities. We've got people that are on the streets with mental health issues, things like that. So clearly, I think our society, our culture, the way we are today with all of the stresses and things that we deal with, there's a lot of folks that could fall into a category of, at least for a short time, that would maybe need some outside intervention, right? Is that what exactly are the duties of the nurse practitioner of mental health? What do you do on a regular basis?
I definitely agree there is a greater need for mental health out in the community. Of course, there's the very obvious mental health disorders we see with the psychotic disorders. However, there are more nuanced mental health disorders that I treat. Depression and anxiety out in the community. We're starting to see that a lot more stresses in life with work, just life in general.
I'm going to interrupt if I can and ask you this. Do we think that as we are raising our kids over the last couple of generations, that the ability to deal with these issues is we're not making our kids strong enough to handle this stuff, or do we see depression as the kind of thing that could get you no matter how you were raised, to keep a stiff upper lip or you know, don't let that bug you or whatever? I mean, how is it that it feels to me, I'm much older than you, Joseph, but it feels to me like yeah, thank you, Brian. Shut up. That I've seen that it seems like we are more susceptible as a society to these kinds of things that we might not have talked about or experienced as much 50 years ago. Am I barking up the wrong tree, or what's your take on that?
So I will say that everybody's experience is unique. I do believe that the stressors back then are very different to the stressors that people are facing today. So
I had it easy. Is that what you're saying?
No,
My stressors were wimpy stressors compared to today's stressors?
Like you said, they're different. I'm not saying they're much easier or much more difficult. And the way to cope with those stressors at that time are going to be different now. So my goal is to help people in the community to understand how they can best cope with their stressors.
Yeah. Well, I recall studying psychology back in the day, and we were, you know, it was B.F. Skinner and Carl Jung and all of this stuff. Have we made enough progress in the last 40, 50 years in terms of being able to provide, have we learned enough about people to be able to provide more effective, quicker aid for folks who maybe aren't in chronic situations? I mean, do we have the sort of quick fix mental health refreshment, like a tune-up or anything like that? I mean, where are we at with stuff like that, Joseph?
Well, with emergency mental health, that's not my specialty, but there is resources out for people that need it. We are starting to learn about new medications with different side effects and such like that. Therapy, that's another focus of mine. That is not a quick fix, but it's something that is we can get people access to relatively quickly, but that process does take time.
I've always thought that, people have the answers in there for people. They may not want to face it, they may not want to acknowledge it, and it may take an extended period of time. But do you think would you agree with something like that if a person puts in the time in therapy, talking about, the symptoms and trying to backtrack to whatever it is that sort of predisposes a person to act a certain way inappropriately in circumstances or whatever, things that might get you requested to see some therapist? Do we carry the answers around with us, and it just takes somebody like you to help us peel it back and to find them?
Yeah, of course. One of the focuses in cognitive behavioral therapy, which is the type of therapy that I utilize in helping my patients, is there's a concept called the inner child. So stressors, difficulties that we may have faced as a child, those hurts carry through into adulthood. So the longer that it takes for us to address that, the more layers that we have to peel back and longer it might take to get to that hurt. So I think it is important that we try to address stressors as soon as we are able to identify them.
Well, I would say also it's important for people to realize as they're hearing what you're saying, and any number of us could relate to it perhaps in varying degrees. But it's never too late. Somebody 60 could hear what you've said and think, I do need to kind of peel the onion and get to the center of really what's going on. But gosh, it would be an advantage if somebody in their teens or early 20s, either they or a family member realizes that this is some kind of, getting to the inner child is important. The quicker you do that, the quicker some healing can take place, and the lessening of future difficulty would be the result. Isn't that true?
Yeah, I totally agree with the sentiment that nobody's ever too late to receive help.
Yeah.
How about too early? I see that you do stuff with children too. What does that look like if you're dealing with someone who's, say, not even a double digit, or someone who's like 8, 9 years old?
So with these young children, when we do our assessment, one of the first things we make sure is that they're safe. If they are, then we work with them to make it easier to talk about their emotions, maybe help them understand why they are feeling these big emotions that they don't know why they're feeling these. And also a big part of that is to work with the family. These families, maybe they're having some behaviors at home they're not realizing is not good for the development of their children. But it's good and essential that we work with the families so they're educated about the process as well. Another thing is providing resources to the families, to the children, if they need help at school. Because if you think about it, school is like a second home to them. They're there for multiple hours. So giving them the resources to be successful in school so they can grow up to be successful adults is pretty important.
You'd almost see it, a child coming in, and depending on what they say and how, nuanced you could get into them, it might be, all right, now send mom and dad in because I really need to be talking to them because they're creating the environment that is creating the problem for the child.
Of course.
What about medications? Some people are concerned that we rely too much on medicine in all fields. What's your take on the therapeutic value of medications in mental health?
Well, I would commend them on their skepticism. I think a healthy amount of skepticism is a good thing.
Yeah.
I will also say that there has been many, many years of research. There's new medications being kind of put out that's being available to help treat a multitude of mental health problems. So I would say come in, talk to somebody so we can address what their hesitation or questions are.
For the chemical side of brain chemistry, serotonin uptake and all that kind of stuff, right? That definitely, I think, has been researched to the point where we really are comfortable with knowing how some of this stuff works, right?
Yeah, of course. There's a lot of research that has been done. I will say that with medication management, we have a very good idea of how it'll help people, but really we won't know how somebody will respond to the medication, to that treatment, until they try it. So that's why it's important they start to see a provider and then continue to see that provider.
I guess, we're all fine. It's the people we know that need help. What do we do when it comes to maybe like guiding a loved one or someone who, seems to be showing signs of not being themselves? How best to talk about this or to maybe direct them to someone like yourself?
It's not easy. I will say that, with a family member, you have a more personal stake. So one of the best things you can do is start by actively listening, showing that you care, and offering up suggestions on how you can help rather than offering answers to the problem.
Good point. And also, it's got to be about them, not about you. You need to get help because you are bothering me. It's got to be, my care for you is that you need to be helped so you can have a better life, etc., and make sure they know that that's the focus, right?
Yes.
All right, so I'm convinced. What about coming to see you? How do we plug into to what Astria is doing, and maybe you or some of your colleagues? What's the best way to move forward?
Well, here with the mental health providers, we prefer a referral through your primary care provider. But me, I am located in Grandview. We have providers across in Prosser, Sunnyside, and Toppenish. So we're accepting new patients. Come down and see us if you just want to talk. I'd be happy to see you.
Wonderful. And of course, all the deets, as always, at astria.health. That can be kind of the way you navigate.
Very nice to meet you, Joseph.
Yeah.
You seem to me to be a calm, measured kind of person, and that's exactly who I would want to have hear my story, and I figure that I'm going to get a well thought through and reasoned response, and not necessarily somebody who's just reacting or whatever. So I think you got the right, like I know, but I think you got the right deportment to be a real help to some folks. So
there you go.
Thank you. I appreciate that.
Yeah, thanks for coming in. We love these house calls. We love finding out more about the folks who are involved in this. We've been talking with Joseph Penaflor with Astria, and if you are concerned about issues in your life and just maybe how to have a better life, coping and dealing with whatever it is that you're dealing with out there, I'll give him or folks at Astria a call. Thank you, sir. Appreciate it.
Thank you again. Astria.health.